Hi, I'm Dr. Pandey. I'm a practicing rheumatologist from Indore. Welcome to IRACON-TV. Today, I'm delighted to have with me one of the senior most rheumatologists of the country, Professor Rohini Handa sir from Indraprastha Apollo, Delhi. Sir, welcome to Hyderabad. How are you today?
Thank you very much, Akshat. I am delighted to be here at Hyderabad for IRACON 2023.
Sir, how was your experience in IRACON 2023 and would you like to comment something about the scientific program?
I think I have witnessed metamorphosis of the science of rheumatology, and I've also witnessed great change in IRACONs. We started with one-room meetings, 40, 50 participants, and now you look at the vibrancy of this meeting, 1,000 plus delegates. You have many younger colleagues who have picked up the specialty, and the science has changed beyond recognition. Gone are the days when we approached rheumatology with therapeutic nihilism. What we see is pharmacologic optimism all around. And this is evident in the molecules that we have. This is evident in the way we treat our patients. So I think we are at the cusp of a remarkable change in the way we treat rheumatic diseases.
So you gave a wonderful talk on William Osler and the rheumatologist of today. Would you like to speak something about it?
The genesis of my talk on William Osler was a chance conversation with my resident where I mentioned Osler in the passing. He looked rather blank, and I was stumped to say the least. William Osler is, for the non-medical people, the greatest physician of modern times, and he was an epitome of what our profession should be. He took medical teaching from the lecture room to the bedside, and the bedside is where the patient is, wrote several influential papers. Many diseases are named after him, and his name is synonymous with what the best of our profession can be. Moreover, he made some pithy observations that carry the name of Oslerisms, and let me share with you a few of his observations or Oslerisms as they are called. One of my favorite Oslerisms is to do with patient examination. William Osler famously said, "To study the phenomena of disease without books is to sail an uncharted sea, while to study without books without patients is not to go to sea at all." And I think rheumatology being the last bastion of clinical medicine, nothing more can be true even today. He also talked about ethics. He also talked about the power of observation. And one of his Oslerisms deals with the fact that no two eyes see the same thing, no two mirrors give forth the same reflection. Look, see, compare, and record. And I think these things are true 100 years later also. But notably, he also talked about ethics, and this was much before the word ethics came into medical practice. And what he said was, I would like to share with you, the practice of medicine is an art, not a trade, a calling, not a business, a calling in which your heart will be exercised equally with your head. And he was talking about ethics. You cannot approach the temple of science with the soul of a money changer. Only a good man can be a great physician. And this is what William Osler was all about. And this is what I wanted to share with the present generation, his Oslerisms, which have timeless appeal, enduring value, which encompass both the science as well as the art of medicine. And let me also tell you something about conferences. We now talk today of CMEs. We talk about continuing professional development. What did William Osler have to say about this? He said, "It is astonishing with how little reading a doctor can practice medicine, but it is not astonishing how badly he may do it." And this was the forerunner of CMEs, CPDs, that a doctor has to be updated. So I think we were rediscovering the relevance of William Osler for the rheumatologist of today.
Thank you so much, sir. I would like every one of you to just download this video and save it with you forever. Thank you. What a wonderful words of wisdom, sir. So, like me, many rheumatologists and your juniors are fan of your writing and reading skills. So, what is your message to the young rheumatologists? How we should improve our writing skills, especially?
I think the most important thing is clarity of thought. If you try to teach everything about a particular topic to everyone, you cannot succeed. You need to have a distillate of what you want to convey. And then when you pitch your talk, pitch it for the person on the last row. Those who are sitting in the front row may already know about it. And when you teach to explain to others, not to listen to your own things or own achievements. So you should teach with the backbencher in mind. And I think that is the importance of teaching, communicating, that trying to involve everyone in your thought process to inculcate the power of thinking for oneself. And this is so very important in medicine.
Sir, any concluding message to the organizers of IRACON 2023? And also, would you like any changes to incorporate in future IRACONs for the future organizers?
What we need to do is we need to have more younger people come up, and this conference was a refreshing change. We need to showcase young talent. We need to have a blend of basic science, clinical medicine, and then we also need to have some time to socialize, fraternize, which is what all conferences are about.
Thank you so much, sir. It was a pleasure having you on this show, and thank you for coming.
Thank you, Akshat.